My name is Matt Higginson. I'm the Clinical Operations Manager for Insight Workplace Health. And it's appropriate that to start this today, that we actually do have a look at some statistics surrounding sickness absence. And just down the road from ourselves here in South Wales, we've got the ONS. And these statistics are taken from 2021, as you'll be aware. A lot of statistics often lag a couple of years behind real time, just to make sure that they've got accurate data. And certainly, obviously, as we'll be well aware, from the statistics that we've got, the vast majority of sicknesses in 2021 were related to COVID, and with over 24% of sickness absence being related to that. You can also see, though, over the couple of years leading up to 2021, that with regards to the cause for being absent off work, the change moved from being minor illnesses to being other, and other included COVID. It included accidents and issues regarding skin issues, infectious diseases, and also diabetes. With regards to the level of incidence of sickness, generally at the moment across the UK, the average sickness absence rate across all regions is 2.2%, with London actually having the lowest sickness absence rate of all areas. For those of my colleagues and perhaps some of our customers who are based down here in South Wales, it is obviously rather frustrating that our current sickness levels are some of the highest in the country. For those of our customers who are joining us from England, you will perhaps maybe be in some of the slightly lower regions. Certainly sickness levels have not been had any significant reduction for some years, other than due to the short period during COVID. As many of you might well be aware from either your own businesses, from your own sectors, or perhaps from previous experience, sickness absence does generally tend to be considerably higher within the public sector. And there's many reasons for this. Often it is related or put down to the fact that there is more beneficial sickness payment schemes. And that's something that we do have to take into consideration when we're thinking about how we manage sickness absence and the culture surrounding sickness absence in the workplace. For many of our customers and for many of the sectors that we do supply services to, occupational health services to, you will note as well that the common areas where we have higher levels of sickness that way exceed 2.2 with regards to the 2.2 figure across the UK, with figures up as high as nearly 4% within some caring services and also within plant engineering, etc. So with regards to the type of challenges that you might have within the workplace, what's the benefit of you engaging with and supporting your staff and getting processes in place? Well, the benefit of dealing with absence is because of the potential impact of absence upon yourselves. Absence from the workplace will have a significant impact potentially upon business turnover, income generation, or the services that you provide to other services, other your customers, your tenants, and secondary contracts. You may also find that it has an impact upon members of your team, perhaps putting further workload onto them. But also, we very much know that absence from work also has a significant impact upon the individual. If any of you are from sectors where you were required to furlough your staff during the COVID pandemic, then you'll be aware that the absence from work, even without underlying health issues, can still actually lead to deterioration in well-being. And that's something that we're trying to combat by improving the rate at which you get your staff back into work. So with regards to the cost to you as a business and the cost across the UK, the cost of sickness absence in 2016 was estimated at being approximately £15 billion. And that subsequently increased to £20.6 billion in 2021, there being a 33% increase with regards to the financial costs across all organisations. And so therefore, it really is imperative that businesses are proactive in addressing all forms of sickness absence in the workplace. As you're aware, sickness absence may be expected and or excused. It might be that you've got staff who are on annual leave, on training, or already off due to health appointments. And in those cases, the business is often already able to put things in place to accommodate those absences. And in some cases, it might be that staff are off unexpectedly and unexcused. And it's likely that in this case, our early intervention may not be of great effect to them at this point. So the main targeted population of your workforce that we're trying to support with our early intervention process is those who are unexpected and those who are excused, people who are off on due to sickness, minor injuries, emergencies, etc. And it is important to recognise that being proactive can lead to substantial savings, as well as improving workforce health and well-being. I note from already that some individuals are adding to the chat at the moment. And someone has just mentioned there with regards to third sector absence figures. Well, it's very interesting. I was just about to ask, are you currently aware of your current sickness absence rates? And if you are, that would be great. Perhaps you could give me a figure in the chat facility just to give me an indication as to whether or not you feel that you're at around about the average for your sector. Certainly, reasons for sickness absence within the workplace. Certainly, we know that with regards to sickness absence, the main reasons for people being off work are relating to mental health and musculoskeletal disorders. And we certainly are aware that unexpected illness and injuries, perhaps needing to care for sick children or family members, are often reasons for people phoning in with sickness related issues. It's also important to recognise that many individuals will perhaps be off work due to burnout or workplace stress. It might be that there's issues with regards to morale or the working conditions. Certainly, we know that being in work is really important for individuals, but it is also important for a job to be important and to be good for their health. A job needs to be meaningful to the individual. They need to understand why it's going to be important. And in fact, with regards to burnout and workplace stress, the World Health Organization actually classified that as a disease several years ago, recognizing its impact and importance to be recognized. With regards to the numbers of absence days lost, well, we know that in 2021, there were 149 million days lost due to sickness. And that equates to approximately 4 days off work for every individual. But the actual number of days varied depending upon what that individual was off work with. So, for example, an individual with an injury was generally off for about 10 days. If it was general ill health, they were often off for 17 days. The average length of time off for stress, depression, or anxiety was 18 days. And for musculoskeletal disorders specifically, 15 days. It might be that within your business, you might find that you've got specific areas where there is a cause for concern. You might feel that it's appropriate for you to drill down as to what is it that's actually leading to these individuals potentially having accidents in the workplace. It might be that you might need to review risk assessments with regard to stress. Maybe your stress risk assessment needs re-evaluating, maybe roles and or resources available, including staffing numbers, might need to be reviewed. Also, are your staff actually engaged with why they might be off sick? Do you have a process in place by which you can engage with them to establish whether or not there are patterns, what their level of job satisfaction is, etc.? And are staff clear, for example, about the resources that are available to them, about what things they can tap into? For example, do you have an EAP in place, an employee assistance program? Have you got access, for example, to private healthcare, and do your staff know how to access that? It's also really important to make sure that you're educating line managers and employees about presenteeism. Certainly, if whilst I've been going through these, talking about strategies and things you might need to have in place, if you're aware of your sickness absence data, you're aware of the reasons, that's great. If you know about the particular areas in which you need to focus upon, that's all fantastic. But if you're not, that might be something you might want to consider engaging with ourselves to help explore as part of your way to deal more effectively and earlier with sickness absence in the workplace. So what actually is early intervention? Well, certainly from my own experience, from having worked in the public sector for several decades, there have been processes or types of early intervention perhaps in place for some time. And certainly the concept about contacting your staff and engaging with the staff, maybe from a line manager perspective, has been around for several decades with regards to it potentially being a benefit. But in order to actually find data that actually proves its effectiveness, we actually need to go to Scotland. We need to go to Lanarkshire, that's just south of Glasgow, and the Lanarkshire area has a population of about 650,000 people. And the NHS Health Board at the time of the study, which looked into early intervention and its benefits with regards to reducing sickness absence, had a working population of about 12,000 staff. And by its own admission, it described itself as having an absence crisis looming. They needed to take action. And so therefore, in conjunction with the University of Glasgow, which happens to be my alumni, so pardon my slight tendency to dwell upon my Scottish links. So in conjunction with the University of Glasgow, between 2008 and 2009, at a substantial cost, undertook a year-long study looking at early and very early sickness absence interventions. And what they did is they actually introduced what they referred to as an EASY, E-A-S-Y, EASY, meaning an early access to support you process. And this study basically, at every point when the individuals phoned up their employers to say that they were sick, that there triggered a response mechanism from their OH. First of all, the individual was asked whether or not they'd be happy to participate within a trial. And following that trial, the occupational health clinicians would then contact that individual on the following days. So they would contact them on day 1 of their absence, on day 3 of their absence, and on day 10 of the absence. And this research, which cost over £350,000, plugged an enormous gap in the research, providing very clear data about practical interventions that employers could do to improve the health and well-being of their staff and keep the staff in work or help them to return to work sooner. As we're aware, and as I've already stated, work, as we know, being in work, attending work, the structure and routine of being work has been acutely demonstrated as being of benefit for the staff well-being and for the well-being of businesses. So what happened during this process of research is that the occupational health clinicians changed from being a reactive service to being a proactive response. So rather than awaiting to be advised from the line manager that the person was off, perhaps maybe several weeks down the road, they were taking active intervention to engage with their staff to hopefully elicit change. And following that conversation on day 1, 3, and 10, it elicited a short report to the employer advising them as to what advice had been provided and expectations with regards to potential returning to work. And how were these results like? What do these results actually look like for when they actually published them? Well, within 1 year of this study commencing, which had generally a very large uptake from the staff across the Lanarkshire Health Board, sickness absence fell to the lowest level in Scotland. And given that they had been in a position of sickness absence crisis, the sustained fall in sickness absence was maintained subsequently to that. And even at the most recent update of the data, this is equating to approximately 250 healthcare workers being available every single day, as opposed to being off work. And the main reason that that was achieved is that in a vast number of cases, those staff had been directed to the appropriate services that they needed to get better at that time. So that might have been, for example, the GP. It might have been relating to mental health. They might have been directed back to mental health services that perhaps were already in contact with. It might have been that they were guided towards workplace counselling schemes or the EAP. And with regards to musculoskeletal disorders, physiotherapy services. So how and why was this effective? What had changed? What was working in this situation to help these individuals get back to work? Well, first and foremost, there was excellent collaboration and understanding between the employer and their occupational health team. And it was that improved communication and the fact that their staff were well informed with regards to what was going to happen when they were off work. And it was the early access to trained occupational health staff who are experienced in speaking to individuals who are off work, who are unable to do their role in work for a variety of reasons, but who are able to effectively nudge and signpost individuals back into work, ensure that they're doing all the things that they need to remain in work, to get back to work, to get fitter for work, but also at the same time, if necessary, to make sure that people don't attend work if they're unfit. It's very important to remember that we don't all have the same capacity to deal with stress, anxiety, pressure, or, for example, even physical health issues. So it's important that that engagement for the occupational health professional with your staff, with the staff in this case here with regards to the staff in Lanarkshire, it was providing tailored guidance, advice based upon the situations they were in at the time of speaking to them. So how can we, Insight Workplace Health, help you to improve your sickness absence? Well, by using our early intervention service, you are accessing a range of support and services. Now, within the initial trial that was undertaken by Lanarkshire in the 2008-2009, they called up their staff on days 1, 3, and 10. Now, that's not always feasible for the majority of staff nowadays. And so we have actually tailored this and have been running an early intervention service for several years with a number of our clients. And we found that contacting that early contact with your staff, with your member of staff who's off work, from the day that you inform us that they're off work, and having a frank clinical discussion with them about the issues that they may be experiencing, has facilitated us managing to reduce sickness absence significantly alongside the other provision of other occupational health services we provide. So our clinicians make early contact with your staff. We have a frank clinical discussion with them. We explore the issues and reasons why that individual is not in work or not able to attend work. We discuss and we signpost them as to what they need to do. We nudge them. And in some cases, we might need to reassure them that, yes, they do need to take time off work to get better, to help them improve themselves and help improve their health, their mental health, their physical health and well-being. And then, if necessary, make a referral and give guidance to you about making an occupational health referral to a full range of suite of services that we're able to offer. For example, our OHAs, are occupational health and mental health nurses, OHPs, clinical psychologists, neurodiversity support, DSC assessors, and workplace need assessments. So just to reiterate, we've modified the easy approach that was undertaken by the NHS Lancashire Health Board and the University of Glasgow. And we found this is very, very effective. So what we will do is that we will attempt to contact your staff up to 3 times over the first 3 to 4 days that they're off work, following you advising us that they're not in work. Generally, the call to the individuals may take from 5 to 25 minutes. And what it does is it generates a report to you, just as in the case with the study that I've already advised you about, advising you as to what guidance we provided to that individual. So how will this look to you as the employer, HR representative or line manager? Well, let's go through an example. So if we have one of your employees phones in sick and informs their line manager that they're not able to attend work, the line manager, using our GDPR compliant EOPAS portal, that's our system for processing all of your data and employee information, they will then advise ourselves at Insight Workplace Health that your individual is off work. At which stage, through an automated process, that will then generate a record whereupon we can then action that, and that our dedicated staff can then call up your staff as soon as we're able to contact them. So once we've got this information here, what will happen is that our occupational health trained nurses will then call up your employee and have a frank and open discussion about the underlying reasons as to why they're off work. So, for example, if your employee is stated that they're off work due to their mental health, we're going to explore that. We're going to find out, have they got a mental health history? Have they been to the GP already? Maybe they're taking the medication. Maybe they've perhaps stopped taking the medication, or they've run out of their medication. We're going to find out that information. And following speaking with the employee, we're going to make clinical notes so that we can then make a judgment with regards to what advice we then need to provide to yourself. And the report is generally generated within 10 to 15 minutes of your employee finishing their call with ourselves. So that means that you get it through our portal rapidly. You've got clear guidance then about what's happened to your employee, the reason why they're off work, with appropriate clinical information where necessary. So looking at the screen at the moment, for example, if we think that this was Mickey Mouse, he's phoned in sick to his line manager. His line manager has informed Insight Workplace Health through the portal. That's generated a record which our nurse has then picked up. They've then phoned your employee, had a frank and open conversation with them about the reasons for their absence off work. And subsequently to that, we then generate a report in a similar format to this last image that appeared on your screen. So in this case, Mickey describes recent changes in his working hours, which have led to him struggling with his mental health. Likely duration of absence at the moment is 7 days, and it's anticipated that he'll be able to, his workplace issues likely to ease once symptoms of, he'll likely to return to work once workplace issues have been addressed. With regards to, is a management referral recommended? In this case, we've suggested that may be a benefit. You are then in a position to make decisions to whether or not you follow that up and have a chat with Mickey Mouse, discuss with him whether or not a management referral regarding the issues that we've advised you is appropriate. So just as a brief recap, early intervention services are provided during office hours by Insight Workplace Health. We, as trained occupational health practitioners, will attempt to contact your employee up to 3 times, and that this will result in a brief consultation, as I've just described, where we'll establish more as to what's actually going on with your staff, why they're off work, the reasons why they can't undertake their job, and that we'll give you an indication as to the likelihood of a potential return to work where we can, and of necessary advice that may be provided. For example, has been advised to speak with their GP, remain as active as possible, take painkillers, etc. You will get an OH response, that is a report from ourselves through the portal on the same day. And as I've just mentioned, there'll be clear guidance provided as necessary. So, for example, would an occupational health referral be appropriate in this case? I note now that there are several notes in the chat. If I'll just have my box up, apologies. Thank you very much for participating there and answering. Certainly there with regards to some of the figures that you've mentioned, with regards to your current levels of absence, 12% does seem extremely high, and certainly if it's certainly worthwhile us having a frank and open discussion and with regards to how we can help bring that down. I note there, Dare 31 has mentioned that higher education has got a sickness absence of 6%. So that's interesting. Can I ask, has anybody got any questions with regards to what we've been speaking about so far? And by all means, please, if you want to ask a question verbally, that's also okay. But you can also continue to use the chat facility. Thank you very much, Alison. Alison's asked, with regards to, have we ever had any pushback from unions about the early contacting of staff? Well, certainly from a practical perspective, I'm a clinician myself, and over the course of the time that we've been running this, I can probably count on one hand the number of times when we've spoken to individuals where they perhaps have chosen not to speak with us. The majority of times when I phone somebody who's explained that they're off work because of mental health issues, or for example, because of a musculoskeletal disorder, the vast majority of those people are welcoming the intervention and support from a trained health professional with regards to their ill health. Unfortunately, we know at the moment that lots of individuals do struggle with accessing primary care. That is one of our biggest challenges with dealing with health issues at the moment. So certainly if we as trained health professionals can guide your staff as to what they need to do, most of the time they're very receptive to that. For example, making sure that they're doing the self-care things to look after themselves, making sure that they're told that, yes, you do need to go to accident emergency with this, or no, you do need to contact out of hours, or to go and try taking alternative painkiller medication, take it for a couple of days. If it doesn't get better, go to your GP. So no, we've not had significant pushback. In fact, a lot of the time we've actually had unions actually pushing for this to actually get additional support. There is an element with regards to the rollout of any early intervention program done through good education. So making sure that you're advising your staff about why you're doing it, the rationale for it. This is not actually about, it's very important that it's not to be used as a tool to to control your staff. It's about making sure that they're aware that you're offering this as a level of support to help them get better, to help them be able to return to work, and if necessary, make sure they can continue to pay their own bills and earn their income. Thank you, Jordan. You mentioned there about, they've asked, can an employee request a review report first before the employer views it in the early intervention situation? So the report here will only go to the employer. There is no report generated to the employee. The clinician will say to the employee, they'll gain consent to have the consultation, they'll explain about what they're going to do, and prior to sending the report, they'll say, this is the information I feel is appropriate for us to share with your employer. Are you happy for me to do so? And as I mentioned before, I can probably count on one hand the number of times that people have said, once they've engaged in that process, that they don't actually want to share that information with the employer. The guidance that we're giving is generally clarifying the information that they probably have already told you, but you're now getting it from the basis of a health professional who's engaged and will have shared additional information with your staff as necessary to help them to hopefully return to work in due course. Rachel, you've asked, how long is the process to refer on the portal for this service? So once you're registered with ourselves, or if you're an existing customer, once you've got a portal, we will set you up. If Joe Bloggs phones in at 10 to 9 to state that I'm off work because I've got stress and anxiety. I'm having stress and anxiety issues due to a workplace issue or due to some personal issues. You will then put that through our portal. That will immediately appear upon the record for our staff. They could even get a call from us within 10 or 15 minutes of them having phoned ourselves. We generally will attempt to ring your staff on the first day, generally in the morning, then about lunchtime, and then about the end of the day. If for any reason we're not able to manage to contact those, or we're not able to get through, or perhaps telephone numbers aren't wrong, we will endeavour to make calls at 3 separate times over the subsequent days. So I'm hoping that might have answered your question there, Rachel. So it's very rapid, and set up and logging on with our logging onto the portal is easy once you've got used to it. It's like any IT system. It's a case of once you know which buttons to click, it's a very, very easy process. Magda Hall, thank you very much. What's the feedback? We can provide you with testimonies if you wanted to drop us a line, but generally, the companies that have engaged with early intervention are exceedingly happy with the service they receive. They see it as a proactive approach to get ground truth, to get information that's going to be of significant benefit about shaping that individual with regards to supporting them in returning to work, or if necessary, taking the appropriate time off and accessing additional health services if need be. Rachel, thank you very much. Has this reduced staff calling in sick in patterns such as Mondays? It might be a regular day for someone to call in sick. Well, certainly within occupational health, we do obviously recognise those patterns. For example, the Tuesday after a bank holiday, it is periodically noted as being a higher instance of sickness absence. That is noted. It is highly likely to improve that because your staff will recognise that if they phone in sick, then that some information is going to share with the employer. So, for example, it's not necessarily going to stop it straight away. However, with regards to supporting your staff and encouraging them to be open and honest, our clinicians are good at taking histories. We're good at delving in and finding out the rationale why someone's off work. For example, someone says, I'm off work because I can't sit at a desk all day. And then you sort of say, well, what are you doing at the moment? And you can ask questions. Then you find out actually they might be able to, for example, do some work from home. So yes, Rachel, it's been pretty good at addressing that. And certainly, if, for example, we had any concerns about whether or not perhaps was frequent patterns of absence, for example, we might notice that, the individuals, this is the third time someone's had an early intervention call, then we might then suggest to you, as part of our report back to yourself, is that you may wish to consider referring this individual to Occupational Health for further guidance about the recent absences relating to whatever issue it has been that's kept them off work. So just whilst, if anyone's got any further questions, I am keen to hear from you. If you want to open up and use your mic, that'd be great. I am also able to answer any more questions if they come through. But just whilst, before we conclude the session today, I'd just like to point to you that I have also just popped up our QR code. So if you do have a mobile phone on you at present, we'd really welcome you just taking a moment to use your camera to scan that QR code and leave us some feedback with regards to what services we might be able to help provide you with, and also about the session that we provided today. Just leave the QR code up just for a few more moments. Has anyone got any other further questions with regards to early intervention and the way that we might be able to help support you, or perhaps with regards to what it actually entails? So, Rachel, if you'd like to drop us an email, what we can do is provide you costs directly that way. So obviously, if you want to contact Insight Workplace Health, go to the website. With regards to the the webinar itself, we will be making the link available in due course. So Sean, if you needed to catch the end of it, or if you wanted to discuss any of it, the aspects, then please don't hesitate to view that in due course. So thank you very much for engaging with and partaking, providing some of your the chat input there. That's really appreciated. The last thing I'd like to say is thank you very much as well for joining today. As I mentioned, we do appreciate the fact that you've taken time out of your day to listen to our webinars. We do hope that you've learned something, and I hope that in due course that we can hopefully provide and support you with ongoing sickness absence issues in the future. So that's all from me today. Thanks very much. Have a good weekend, and we look forward to hearing from you in the very near future. Goodbye.